Assalamualaikum warahmatullahi wabarakatuh. Today we would like to presenting interpreting in mental health care. The member of this group is Kumala and ditafia adiniannda. Okay, interpreting is in mental health care is done consecutively with patient interpreter therapists, taking turn one after the other. Interpreter in health encounters can be face-to-face or via telephone. Video interpreting is not yet widely available in the most countries. A large number of mental health workers are engaged in sessions with patients, psychiatrists, nurses, psychologists, social workers, psychotherapists, and etc. Interpreting is interaction. Interpreting in mental health care is part of community interpreting, and as such fits in the realm investigated by Wendy's Joe, who concluded that interpreting is interaction through her work. It became clear that interpreting has to be seen as an interaction involving the interpreter, the mental health care provider, and the patient. As such, interpreting is a form of cooperation. The continuum of interaction. The involvement of the interpreter in the interaction ranges across a continuum, with the interpreter as a translation machine or one and the interpreter as an independent participant at the other. In order to simplify matters, there is a number of positions on this continuum. Here is the following position: the interpreter as a translation machine, the interactive interpreter, the interpreter as a cultural mediator, the interpreter as a co-therapist, and the interpreter as an independent participant. The interpreter and the mental practitioner. Interpreters always work together with other professionals and their patients or clients. They have to select their way of working in conjunction with their participant in talk. Both emphasize the importance of the interpreter and the mental health practitioner working in the same position along the continuum. If expectations about one another's loss do not match, irritation will ensue. Mental health practitioners work in very different styles. In fact, they have their own continuum interaction. The cooperation is both interpreters and mental health workers use various of working with patients. Both professionals can be more or less involved as person in the interaction. Depending on the type of the patient, the type of institution and its philosophy, and the therapist on idiosyncrasies, a method of working will be selected and the interpreter will be expected to match it. It is important that therapists and interpreter manage to adjust their styles to one another.
Hello, introduce myself. My name is ditafia adiniannda, and we are group to presentation about interpreting of the mental health care. And I would like to explain about this mental health care, and to continue kumala. Okay. This is the next slide is empathy, emotion, and attitude. In the general, empathy with the patient is the guiding tone in the mental health encounter. Empathy with his situation, his feeling, his strength, his inadequacies and weakness. Repetition. Empathy is shaped in the word of the therapist speak, but it is also formed by paralinguistic and nonverbal behavior. Therapists are trying to pay attention to this aspect of the communication. For interpreter, however, this is much less the case. It is important that interpreter and therapists are also fine-tuned in this respect. It is hard to outline precisely what this entails, but at the same time, in this clear that this delicate and important issue. Interpreters should be aware of their body language and especially when working via the telephone. The intonation, diction, and other paralinguistic factors, as they are very important in the shaping the feel of the encounter. For therapists and interpreter to cooperate, it is necessary as far as expression of emotion are concerned that the interpreter and therapist are the consistent. It becomes confusing for the patient and in the general not conductive to effective therapy when for the example the interpreter laugh about something the patient say while the therapist feel there is nothing to laugh about. Not to mention even the confusion that occur when interpreter make clear in nonverbal behavior that they are not approved of the therapist in intervention. Okay, the next slide is the word translation in mental health encounter. The words are important. In healthcare, diagnosis and treatment is regularly based on the word exchange between care practitioner and patient. In general, in order to interpret the words in encounter well, one should have knowledge of the counter's interactional purpose and the specific conversational techniques that will be used to meet this purpose. The mental health field is vast and differentiates, so it's difficult to list within limited space what all this entails. Okay, white. Okay, the mental health field. The mental health field is divided into two parts. In this one, psychology treatment. The psychology field can be divided into the two parts. The structure therapies include among others from cognitive behavior therapy and a movement desensitization and processing counseling therapies consists of the psychodynamic and experiential client or client-centered therapies. And the part of the uh, psychotic patient. Not surprisingly, there is not empirical research about interpreting in the session with psychotic patient. Often, the sessions are not planned ahead, and the patient is not positioned to consent to participate in research and have the session recorded. It is thus very difficult and maybe even possible to conduct a research while adhering to ethical standard. The next, the last slide is conclusion. At present, many an interpreter and nearly all mental health practitioner lack education and training in how to move along the continuum of interaction in their cooperation. They also lack background knowledge about their respective area of the expertise. Therapists are often shockingly unaware of the threat of interpreting their verbalist translation machine idea, while at the same time they do not shy away for using the interpreter as a co-therapist or informant. As a result, finding matching position and the continuum is often difficult. And then, but professionals like the word to define their cooperation. The challenge for the future lies in the training uh, both interpreter and mental health practitioner in this area. In the training of healthcare practitioner, a lot and a lot of attention is paid to communication, as it is understood very well that good communication lies at the basis of good healthcare. Breaking the language gap should the part of the training, like with interpreters, should be trained in the principle of the mental health care. So thank you for today.